Okay, so now we're gonna do a closed sectioning on a patient that's ventilated. So what we want to do, the reason why we do this is to go ahead and remove any secretions that the patient may have in order for the patient to breathe more comfortably, and to just also to prevent any type of aspirations into the lungs. So what we want to do before anything is we want to come in and assess our patient, check their oxygenation levels, and we also want to hyperoxygenate. So usually for a patient that's on a ventilator, they'll just have a button on the ventilator that says hyperventilate, and we'll go ahead and hit that. Then we want to make sure that our oxygen is working, so we'll go ahead and check it. Make sure we have our drainage system, our chamber here, and that we have our suction by the bed that's easily accessible. So we also want to make sure that our suction pressure is set anywhere between 80 to 120. So because this is a closed suction, we don't need to have a sterile field. All we need to do is have regular gloves. So we'll come into the room, provide our patient some privacy, introduce ourselves, get our two identifiers, kind of explain the procedure. Even if our patient is sedated or not able to hear, we still want to, be conscious of them and just explain what's going on. So what we'll do is we'll go ahead and perform hand hygiene and put on our gloves. So if this wasn't on, then we go ahead and attach it to the trach. Then what we want to do is attach this to the suction, making sure that the catheter isn't all the way in. So we'll normally see that with this little black line. We want it to be as further out, closer to the green port as possible. So I'm going to go ahead and attach this. Then, as we mentioned, this will normally be locked as it should be when you leave the patient. So we'll go ahead and unlock it like that. Then we want to go ahead and suction. Provide suction, make sure that it's working, and it is. So now what we're going to do is we're going to go ahead and insert our catheter. So we want to go ahead and hold this with our non-dominant hand and have our finger here ready to suction. Then with our dominant hand, we're going to go ahead and insert up until we no longer see the black line, or until we hit resistance. Right here, we'll go ahead and push for suctioning, and then we'll go ahead and remove. Once we do that, we'll go ahead and give our patient a break. We should have oxygen on the ventilator, so they should be okay with that. After that, we'll wait a few seconds, and we'll go ahead and repeat the process as with our first, as with our other suctioning or open suctioning. We don't want to do this any more than 3 times and for about 10 to 15 seconds. Push, provide continuous or intermittent suction depending on your hospital's policy. Now that that's done, if we needed to kind of clear out the mucus, we would normally have some sort of saline vials that we can normally put in here. So we'd open this, clean our port with alcohol, grab our saline vials, attach it here, make sure that it drips, and then when it does, provide one last suction in order to clear out any type of secretions that we have there. Do this for our 3rd time. Go ahead and suction. Then remove the vial. It should be empty at this point. Close our port. And then what we want to do now is we want to go ahead and lock this. So we'll go ahead and flip it 180 degrees. It'll be like that. And then to make sure that it's locked, so that way we don't accidentally continue suctioning, harming the oral mucosa lining. So we'll go ahead and do that. Then what we're going to do is we're going to go ahead and doff our gloves. Then we'll go ahead and lower the bed, raise our handrails, place our patient in a comfortable position, and exit the room.